As the number of coronavirus cases continue to rise in Israel, the health ministry has a message to all hospitals around the country. Cut non-coronavirus care. A letter sent by the ministry to all hospital administrators demanded that within 3 weeks, 80% of all beds be allocated to patients with COVID-19. The decision is creating friction between health authorities and those on the front lines of the crisis. At Hadassah, one of Israel's largest and best-known hospitals, it's currently treating numerous people who contracted the virus.
In Jerusalem specifically and in Israel, that things are more or less under control. I don't see, it's not evident based on what I'm saying, but my feeling is that we are not running into the direction of Italy and Spain and what happened in China and what is happening now in the United States. We are not there, and I believe we will not be there.
Naila Hayek is a supervising nurse in the Hadassah's intensive care unit. She says she is making do for now, even as health systems across the globe teach her on the verge of collapse.
So far, so good. Today, and we did have in this week enough ventilators. I think that we have 150 and there are another 30 ventilators are in their way to our hospital.
Hayek says that new staff will be needed. Preparing them for the challenge has become one of her top priorities.
We know that we maybe will need more nurses in the ICUs, a theater. That's why we are doing a lot of training for the nurses.
Hadassah officials made clear that the coronavirus transcends borders and does not discriminate among people. They are coordinating their response with medical professionals across the globe.
We are linked around the world, all the ICU nurses, we have a link all around the world, and we're ongoing minute by minute. How is everyone coping? My Italian friends, my French friends, the nurses in the UK, how are they coping with this huge amount of critical patients?
The cooperation also extends to the Palestinian territories.
We have also physicians that were trained here, ICU physicians that were trained here, who now work in Ramallah and Hebron and all the West Bank. So we know that they're trained and we have connection with them constantly.
Doctors tell us that the steps taken by the government has helped in containing the pandemic. However, they say they are still planning for the worst. At Hadassah Hospital in Jerusalem, Mohammed Al Qasim reporting for the Media Line.